Good evening, good evening, good evening. Welcome to another edition of Morning Star Community Christian Center's Life Study. We come to you live and in living color every Thursday evening at 7 p.m. And of course, this Thursday is no different. And we welcome all of you who have tuned in on this evening for a very exciting and very dynamic program. And we're so glad that you have tuned in. And as always, we encourage you to call somebody, text somebody, let them know that the life study is on. Morning Star's life study is on. Let them know right now, give them a heads up. And as always, at the beginning of our program, we always remind ourselves of what it is we are doing. We take our Bibles and or the digital devices on which we have our Bibles, and we remind ourselves of what it is we do as we hold up our Bibles and we refresh our memories as we repeat these words after me. We say, "This is God's holy word. Receive it, believe it, and achieve it." And the foundational scripture for today's lesson, or this evening's lesson, is found in 3 John 2. 3 John 2. 3 John only has one chapter. So 3 John and 2, which says, "Beloved, above all, I pray that you prosper and be in good health, even as your soul prospers." The word of God for the people of God. Thank you so much for joining us. We have a very exciting program for you, a very informative program for you, and prayerfully a very motivational program for you on this evening. But first, let me just make this announcement. This coming Saturday morning at 10 o'clock, our back to school breakfast being sponsored by our youth ministry. I'm inviting you all to come on out and share with us. Our back to school breakfast this coming Sunday morning, 10 o'clock at the Star. Sunday morning, 10 a.m. at the church, our back to school breakfast. Come out and support our young people. All right. We look for you and we thank you for your presence in advance. That's announcement number one. Announcement number two is this, and we'll be reemphasizing this on this coming Sunday. Next Thursday, we're going to be going to, as a church, at a congregation, we're going to be going to support True Word Christian Center in their 5th anniversary in Elizabeth, New Jersey. Morning Star is going to True Word Christian Center to support them in celebrating their 5th church anniversary in Elizabeth, New Jersey. That's where Reverend Leonard Grayson is the pastor. And the church is located at the corner of East Jersey Street and 1 and 9, going south. The corner of East Jersey Street and 1 and 9, going south. All right. So plan to be with us. Plan to go with us. That's and that will be at 7 p.m. The service will be at 7 p.m. on this coming next Thursday. All right. Plan to be with us. So on this evening, as I said, we have a magnificent program for you, and we're excited about it. And we have with us to give us the latest on our health and our well-being, to give us the latest on our health and our well-being. We have our resident experts. We have the best experts we can have, and we're glad that you've joined us, because you're going to be informed. You're going to be glad that you tuned in. So this is, I'm excited about it, because it's always, we're always well informed when these experts present. Dr. Muriel Raphael is the head of our health and wellness ministry. She's going to take charge in a moment and bring on the others, and they're going to share with us information that's going to result in our being more healthy and more wealthy and more wise. She's joined by our sister Brene Joseph, who is a registered nurse, also a part of our health and wellness ministry. She's joined by our deacon Sandra Hardy, who's a registered nurse. Again, another complete expert in this arena, and she's joined by our sister Kathy Jackson, who is another expert in how to stay well, get well, and stay well. Expert in exercise and nutrition. You're going to be blessed on this evening, and I'm going to be quiet unless I have a question, and I'm going to turn it over to Dr. Muriel Raphael and let her carry it forth from this point. Stay tuned now and get busy and inform somebody else. Hook them up with this program because we're all going to be blessed by it. All right, Dr. Muriel, carry on.
Good evening, everyone. Thank you, Pastor, for the introduction. Once again, as stated, my name is Dr. Muriel Celestine Raphael, and I'm joined by the Health and Wellness Ministry, who have been a blessing to this church and provided their services and their expertise in their specialties throughout the years, in addition to providing health services at the church on Sundays and during special events. We are spread out throughout the service, enjoying the service during those particular times, but we're also keeping an eye out and making sure that everyone that's in attendance is healthy and enriched by the service, and there are no incidents or accidents there withstanding. As stated, I am going to be joined by Nurse Brene Williams Joseph, who is my co-chair, Deacon Sandra Hardy, who is our resident statistician. If you want to know the numbers, what's going on regarding any of the pandemic numbers, any of the flu numbers, this is who I often consult, as she has those statistics at top of head. And as stated, we also have our resident exercise guru, Kathy Jackson, who is going to help us learn how to insert some prevention into this conversation, because a lot of times when we do speak to our healthcare workers, a lot of times when we do speak to our healthcare workers, we don't talk about prevention. We are treating and not necessarily trying to prevent from getting on medicine. So how do we try to stop this cycle? Kathy will be letting us know. So I'm going to ask everybody to join us at this time so we can start the discussion. As Pastor said, please alert someone else to this forum so that you can be enriched by it and you can help us with the discussion as well. Welcome, welcome, welcome. Yay. Hi, guys. So it's always a party when we see each other. So as Pastor has stated, and you can probably hear in my voice, it is allergy season. We are into cold season, as my kids have brought the colds home from school, and we are also gearing up for flu season. And in the background, there's still the COVID-19 residue from the pandemic that we're still dealing with. What is it that you guys have done to try to prevent some of these bugs from entering the home? With reference to I know myself and Brene, we have children, and everyone else goes outside. You're touching things, you're interacting with people. We've kind of released the masking it's to your it's at your risk, so to speak. So what have you guys been doing to just try to steer clear or make do with the symptoms that have arisen so far? Who'd like to start?
I'll start.
Yay.
Okay. Well, of course, washing our hands, that's number one. And
Right.
doing what I do, working with a lot of people, there's a lot of touching, there's a lot of hugging and so forth. So cleaning our hands is one. And as far as like catching the cold or the flu, you want to, before you get sick, you want to be active, because when you're active, that flushes out those bacteria that can lay in your lungs and in your airways. So don't work if you're already sick, rest, all right? But before you get sick, try to get a workout routine in there. It doesn't have to be anything extreme. You just want to be active. And when you're active and something comes around, your body is more capable of combating it.
Correct. And that's what we meant by, the prevention.
Mhm.
Usually we have our resident dietitian, Sharon Mozak, but she had a conflict this evening, but she probably would stress, the vitamins, not so much the
Right.
vitamins, but attaining the vitamins through nutrition. As she states, well, we buy all these vitamins and then, we're flushing them down the toilet. So it's just expensive water in the toilet, so to speak, after ingesting, the vitamin C's, the vitamin D's, the echinacea, the elderberry, and all the others that we could have attained from getting, our seasonal vegetables and our fruits, inserting those into our plates, making some of our other dietary needs a little smaller, like our carbs, smaller intake of rice, smaller. I know I'm speaking from a Caribbean background.
Mhm.
Smaller intake of the starches and more leafy greens and more vegetables and fruits to boost the immune system. So that's important as well.
Mhm.
I know Brene has some, yes. I'm sorry.
I was going to say also, besides, hand washing as well as keeping your environment clean. But as we go into this winter season, people that are have immune systems or over 65, they need to start thinking of probably having to wear their mask again, because we're coming into the flu season, the COVID season, and we're going to be indoors more than we had been during the summer or summer months. And so we need to begin to think about, having to wear your mask during that period of time, as well as I said, cleaning your environment and also the hand hygiene. When you're out, and also, as you mentioned, besides exercise, getting out there and getting that fresh air. But also remember, as we go into this season, we need to also include our vaccines, our COVID vaccine and also our flu vaccine we need to get. And you can start getting them now. But as October comes about, that's when your physicians and everyone else will encourage you to get them. Most of things like CVS, Walgreens, you can get them now, anyway, and as well as from your physicians.
And it's usually better to get them now, because then at the local pharmacies, they end up having a shortage within the next couple of months. So the sooner the better.
Right.
And I would like to touch on gut health. Gut health is closely linked to the immune system. About 70% of your immune system is in the gut. So it is like it's already been stated, it's very important to eat a well-balanced diet that's high in fiber, which includes your fruits, vegetables, whole grains, legumes, beans, nuts. And the fiber pretty much will help with the food. I'm sorry. Oh, the fiber helps with producing that healthy bacteria in your gut, which is needed so that you stay healthy. So just make sure that you have a well-balanced diet, and of course, as stated, rest, exercise. You want to also manage your stress. Stress is a big factor of whether or not it plays a big role also on your immune system. You want to stay hydrated. So
Mhm.
that's your water, your teas, your coffees, but of course, water is always best. And you want to, if you are sick and need to use antibiotics, you want to be careful with antibiotic use. And if a doctor was to order an antibiotic, just make sure that you're completing the entire course of the antibiotic. Otherwise, you can have bacteria grow from not completing the entire course of the antibiotic.
Correct. And then you can end up having something that's resistant to subsequent treatment and possible hospitalization, getting one of those super staffs or one of those long named bacteria.
MRSA,
MRSA,
Plus,
MRSA,
Klebsiella.
Mhm.
E. coli. Yeah,
Yeah,
the list goes on.
yeah, have
Yeah,
them
the
married.
list goes on. C. difficile. Yeah.
Yes,
That you don't want.
No,
exactly.
that's definitely not.
No, it'll make it extremely difficult to treat you if you don't follow directions when pertaining to your medications, which
Yeah.
is absolutely correct. And I wanted to touch back with something Deacon Hardy said with reference to the masks. For me, I know I was a big masker, and I feel like even with allergies, that the mask somewhat helped me a little bit more. So don't feel bad about wearing your mask if you're going somewhere that you don't know everyone per se, or a different environment, or it's probably going to be like close quarters, like funerals and church services or what have you, where you might be sitting in close proximity to people that you don't necessarily know. I like to take a lot of precautions because I'm intergenerational. I have my kids, and then I do have my parents who I interact with frequently. So they might bring something home from school, and so I'll just wait a few days and monitor before I interact with my parents, just to be on the safe side. And that's pretty much how we kept each other healthy during high peak seasons, and of course during the COVID-19 pandemic.
Mm-hmm. I wanted to piggyback off of something that Renee said about stress. Exercising also slows down the release of those stress hormones. And so there are some stress hormones that can increase your chance of getting ill. So exercise can knock that right on out. Well, it will help reduce it. Mm-hmm.
Stress kills. Simple.
Yeah. Mm-hmm.
Stress be at the root of just about anything, and it affects the gut.
Everything.
So, so it's all interconnected. So once you're taking care of one system, you're pretty much helping to take care of another. And so if you're one of those people, like myself, who doesn't have, at my age, high blood pressure or diabetes, then keeping active will probably, prolong or keep that away totally. There's a lot of us that just rest on, I'm healthy, I don't need to be doing anything. We all need to move. You all need to go outside and touch grass at least once a day. Get some sun. People are, oh no, I have dark skin, especially in our community. I don't need the vitamin D. And then when you go to the doctor's office, you find out you're deficient because we've been inside all winter. So a little sunlight, some fresh air does wonders and is nature's medicine.
Yeah, and sunblock.
Mm-hmm. Yes.
And
yes. Mm-hmm. Anything in excess is not good.
Right.
Can I?
Oh, we forgot you were there. No, just go ahead.
Let me ask a couple of questions that have been stimulated by your conversation, or make a couple of comments.
Mm-hmm.
Well, first of all, I need to amend the announcement that I made. I may have said that the back to school breakfast is Sunday morning. It's actually Saturday morning. If I said Sunday, I said it incorrectly. The back to school breakfast is Saturday morning. This Saturday morning. This Saturday morning, not Sunday. This Saturday morning, 10 a.m. This Saturday morning at 10 a.m. Please, forgive my my misstatement there. If I said Sunday, I did not mean Sunday. I meant Saturday morning. This the day after tomorrow. Now, back to the discussion, which I found fabulous. It sounded like, Sister Bonet, you were emphasizing in terms when you mentioned the taking care of the gut, and a significant proportion of our immune system is found there. It sounded like you were emphasizing, if I didn't know better, it sounded like you were instructing all of us to become vegetarians.
I mean, that's a personal choice. I'm a pescatarian. But you are what you eat. The healthier your diet, the less problems you will have. So I mean, I just think that's something that we really have to take into consideration, especially when it comes to your immune system. And if you have a chronic illness, you know that weakens your immune system. I myself, I have a chronic illness. Everyone knows I have sickle cell disease. If you don't, I have sickle cell disease. So you know, trying to stay on top of that is very important. And then especially with having, like Muriel stated, a daughter who's also in school. She got me sick. So if I'm nasally, I apologize. She had a cold a couple weeks ago, and of course now I have the cold. But staying hydrated, eating a healthy diet, exercise, managing my stress, that all helps with improving my gut health and cutting down on that inflammation.
Okay. Yeah, and then Sister Kathy, I know you're expert on the whole exercise thing. In addition to the other items that you specialize in, and I talk to so many people who have such a struggle with not starting an exercise program. Everybody's good on starting one.
Mm-hmm.
The challenge is keeping it going.
Right.
Do you have some tips for people to help them keep an exercise program going and going and going and going and going?
Mm-hmm. Well, what I realize when people say, well, I'm going to start working out, they take on a whole bunch at one time. And it's almost impossible to keep up with. So they kind of deter themselves from doing it. Well, that was too much, so I'm not going to do it again tomorrow. So I always tell people you want to start off nice and easy. I know a lot of people like to start off, well, I'm walking. I say walking is fine, but that's something that the body is used to doing. So if you're going to use walking as your fitness, let's load it. All right. Let's take it out of its comfort zone. Walking, your body is used to walking. So let's add 2 or 3 pound weights when you walk it. Simple as that. Do your normal walk that you do. Don't do no more. And as you grow, as days go by, you'll grow. I always say, put a little pep in your step. Don't walk like you walk into the bathroom, to the kitchen, and put a little pep in your step and move your arms. Okay. That if that's what walking is going to be your fitness, if that's what you're going to do. And I always say, don't say, well, I'm going to work out every day of the week. Say 2 times, 3 times out of the week. Start with 15 minutes. Don't take off more than you can bite. You understand? So you want to make it nice and easy where it's doable for the next day. And find an exercise that you like doing. Do something that you like doing. Say, oh, I like squatting. So just 3 times out of the week, 2 times out of the week, get you 10 to 12 squats and be done with. But you want to grow yourself. Don't stay there. All right. Little and easy. I always say, you do not have to be extreme to get fit and healthy. Little bites at a time. Don't overdo yourself. Little bites. Little bites is the way to go.
Mm-hmm. And Deacon Hardy and Dr. Muriel, listen. Each of you have heard of the quote anti-vax movement. Speak to that. Anyway,
Well,
anyway you see fit.
well, you know, the anti-vax movement, I think a lot of that, you know, and I think first of all, a lot of it comes from in 98, where there was a study that was done. It was a poorly done study saying that vaccines cause autism in children. It was flawed. The person who wrote the study lost their medical license because a lot of it was misinformation, was incorrect information. But a lot of people will go back to that study and say, oh, this is a study that was done. And as I say, this study is not correct. When you look at vaccines throughout the history, I mean, look at polio. We probably would have still had polio if we didn't have something vaccine for polio. Look at measles, mumps, rubella, all of those childhood diseases that we do have vaccines for. And some people still don't take the measles or rubella vaccine. And we've seen, like in New York, I think about a year or two ago, where the Orthodox community did not take a lot of that, those vaccines. And they had a lot of people in that community that had measles. You know, for children, sometimes it's easier for them to get through, but as an adult with those diseases, it's kind of very difficult. So, you know, people say, yeah, well, you know, I have to take this vaccine, like for COVID. Yes, you have to take a COVID vaccine, and yes, you have to take a flu vaccine. And so people say, well, why do I have to take all of these vaccines? Well, they're two different organisms, you know, so they have two different vaccines that treat them. You can't take the COVID for the flu, and you can't take the flu for the COVID because they're both two different types of vaccine. So yes, you have to take these two. And, you know, for myself, you know, those things are helpful. I mean, I'm definitely going to be taking it because I know what I went through when I had COVID. And, you know, I just didn't have COVID. I had a pneumonia on top of that. So, you know, I was fighting two battles. So yes, I'm going to go out there and take my vaccine. And as I said, some people you'll have, and then some people, regardless of what you say, you know, they'll still say, well, I don't want to take it. But if they've had relatives that have been sick from it or whatever, even people who I know, some people said, well, I don't want to take the shingles vaccine, but there are people who have had shingles. And if you speak to some people who've had it and didn't have the vaccine, they will tell you that it is very painful.
Mm.
And it stays on for months. It's not like 1, 2, 3, I got this little vaccine and, you know, the shingles and it's gone. Shingles will stay on for a long period of time. So again, you know, you educate people on the need for vaccine, you educate on them as to why it is important to have it. But then there are a lot of people who, regardless of what you say, will say, well, I'm not going to get it. And, you know, as I said, you just have to do, hopefully those people will not get sick.
Yeah.
Yeah.
I know for myself, when the boys needed to be vaccinated, I think a lot of times people don't take into consideration that we also have families. So we also have to mull over certain things or, you know, think about certain studies like Deacon Hardy said, there was always the gnawing about, you know, the autism correlation and the high incidence of autism in boys and the frequency of the vaccines, you know, possibly leading to, you know, that high incidence. So I had open conversations with my pediatrician. She, you know, spoke to me about, you know, spacing out vaccines if we wanted to, but, you know, just to alleviate some of my angst or anxiety. And so I know I've spoken to, you know, family members who are also in the medical community who also had, you know, some of those fears as well. I think open conversation with your provider also helps. But you know, we have people that, you know, prefer to rely on the herd immunity, but then end up, you know, possibly contributing to, you know, the outbreaks like Deacon Hardy referred to as the, you know, the ones that we've had, measles or what have you. I know in my profession, we deal with a high Jewish community in certain parts of New Jersey who are against of course, the COVID-19 vaccine, against some of the vaccines for children, such as the HPV vaccine, because of some of the indications for which, you know, we've said for them to take it. But I think we just needed to converse a little bit more with that community and say, well, this vaccine also prevents cancer, not just other things which you don't want your children to be participating in. We're going to be possibly fighting cancer in girls and in boys later on in life. So it's how you couch the conversation, and it's open communication and speaking up for yourself. You may not necessarily want all 3 vaccines, and then of course there are, like the measles, mumps, and rubella. You can possibly find a provider that might be able to give it to you separate, give it to your children separately, speaking from a pediatric window. There's also people I know with reference to the flu vaccine who have had adverse reactions. I can't tell somebody who got sick after taking, a flu vaccine, oh, you should go, take another one. That's their personal interaction with the vaccine. So, but as far as, someone who hasn't had any issues with it, it'd probably be in your best interest, especially when we're dealing with people that have existing comorbidities such as diabetes, high blood pressure, what have you, which may exacerbate other symptoms and, decrease your capability of fighting off some of these simple viruses because you didn't want to have a vaccine.
Another thing people have to realize, there's some people that, yes, may have a reaction, but the vaccine itself, if it's a shot, for the most part, it's a dead vaccine. It's not a live vaccine that you get. The only live type is a nasal, but most people get a shot. That's number one. The other thing is that a lot of times you may have the organism already in you before it takes effect. Usually it takes your body at least 2 weeks or more to develop antibodies. Antibodies is something that you can use to fight the virus. So a lot of people say, oh, I got my shot and I got the virus, or I got COVID. I just had a shot and I got COVID. Well, you might have had the COVID virus in you already. And a lot of times it takes a couple of weeks or a week or so before you actually see symptoms. And the other thing is, like as I said, it takes your body a while to develop the antibodies. So you can get the shot, but you have within that window period of time that you may or may not get, sick from COVID, because your body has not developed the antibodies to fight against that particular, organism, COVID or whatever. The same thing with, the flu shots. So I think that's, some people just, and I've heard that from people, oh, I got the shot and I got the flu. The flu, the shot gave me the flu, but it didn't give you because it's a dead virus at this point.
Okay. And just going back to the flu vaccine, a lot of schools actually are now requiring, excuse me, children to receive the flu vaccine if they're going to be in school. For instance, my daughter's school, it's required that she has to have the flu vaccine in order to be in school. Otherwise, she'll be exempt after this month. Even the daycare prior to where she was attending, she was required to have the flu vaccine. However, because it was later in the season when it became required, I was able to get that exempt because it was April when they were asking.
Yeah, it's kind of late.
And that was very late. It made no sense. But for this September, for this school year, she did have to receive the influenza vaccine. I mean, you can receive a medical exemption, but for most schools, a lot of schools going forward are requiring that the children have influenza vaccine.
Are there any exceptions? I mean, like other than medical? I mean, for example, what about religious or what about religious?
Yeah, there's medical exemptions. There you have your religious exemptions, and
Okay.
then medical would be like, say, if the child had previously had an allergic reaction to it,
Yeah.
or something like that.
Right.
Or yeah, or they have an allergy to shellfish. It just depends.
Yeah.
I believe it's shellfish, iodine, those allergies.
Got it. Okay. So how does all this stuff affect black people? Are we worse off when we consider these things? Should we be more urgent than other people? Are we the worst impacted or affected? Should we be the first in line? Do the statistics say that we're at the bottom of the barrel? We're dying more rapidly at a higher rate. What do the numbers instruct us, or how do the numbers guide us in terms of what we should be doing as a people, if you will, with regard to both COVID and influenza, and other upper respiratory type illnesses like pneumonia and so forth? I just threw that to the whole group.
Oh, yeah, I know during COVID, the numbers, there were more people of color and African Americans, Hispanics, Asians that died from COVID. If you look at the CDC numbers, there was a higher number than that. I don't know off the hand the numbers for the influenzas in terms of African Americans, but I think that we don't necessarily always, for whatever reason, go to the physicians to get either our vaccinations. You don't have to go to the physician. You can go to, Walgreens or CVS. But we don't always go. And sometimes, we don't go because we have to be educated or we don't understand. Or sometimes, we don't go for various reasons. But sometimes what you need to do, maybe you need to take a partner with you. A lot of times I'll tell people, when you go to the physician, you have to be your own advocate. And sometimes if you don't understand something, ask them. I don't understand what you're saying, kind of break it down to me. Or you may need to take someone that you feel comfortable with, a relative or a friend that can be with you in the physician's office. And the physician will ask you, is it okay to speak, freely in front of this person? You can say yes, because sometimes you miss what they're saying or what they're telling you. And this doesn't just go all just for, vaccine, this just go for health reasons at all, your heart disease, kidney, whatever, blood pressure. Sometimes you miss what the physician is saying to you, and that person that may be with you can say, well, he said such and such a thing. Or you should also, sometimes I tell people, make a list of questions to your physician, so that you can sit down and say, wait a minute, let me see, because a lot of times you'll forget, I want to ask him this, but then when you get there, you may be so nervous, you can forget, oh, I meant to, and then when you leave out, you say, oh, I should have asked him such and such a thing, or I should have asked him that. So sometimes it's good just to make a list of some questions that you want to ask them. That's some of my comments.
People of color tend to, and that includes Black and Brown, tend to lead the charge when it comes to non-compliance, whether it's due to socioeconomic, cultural, or educational deficiencies. We are more prone to the comorbidities, the pre-existing conditions that lead to heart disease and or high blood pressure and diabetes due to a lot of our SDOH factors, where we live, how we eat, our economics, where how we're where it is that our homes are located, affect all of that. Education is pretty much one of the main things that we need to use to combat the non-compliance, as Deacon Hardy has stated. Educating yourself about your health, educating yourself about your needs, being your own advocate. I know a lot of our elderly people that are on, Medicare, Medicaid, can be care managed. So you can speak to some nurse managers and ask them to ask questions, ask your provider questions, get information with regards to, why am I doing this? Brene's a care manager. She could speak to that. Jump in.
All right. So yes, I am a care manager. So one of the topics that's always covered every season, starting about July, August, because that's typically when flu season starts. That's typically when the flu vaccine becomes available. So we, begin to provide that education on vaccinations. And it's not just flu, it's not just COVID, it's also pneumonia. A lot of people forget about pneumonia vaccine. And the reason why they forget is because it's every 5 years. It's not something that's taken every year. So, and when you're dealing with the elderly population, which is mostly what I deal with, typically they're not going to remember whether or not they had a pneumonia vaccine within 5 years. But that's something that, you always remind them to talk about their providers with. If you are, and then, yeah, you talk to your providers about the vaccine, especially during when and most insurances do provide some type of, nowadays they do provide some type of case management um program for the members. It may not be a full case management program. Like for myself, I'm a MOTSS, which is Managed Long-Term Services and Support. It's a part of Medicaid. However, I know Aetna, the big MCOs like Aetna, you have Cigna, Amerigroup, Horizon, Blue Cross Blue Shield, Ox United Health. They all do provide, those private insurances do provide case managers, because if I wanted a case manager myself, I can have one with my private insurance. So that's another person, that's something else you can look into. Reach out to your insurance to see what benefits they provide, because not only do they provide case management programs, they also provide exercise programs. Sometimes they will pay for you to become a member at a gym. Like I know a big thing with Medicare is Silver Sneakers that you can look into. They have rewards. A lot of the healthcare the private insurance have reward systems.
Nutritionists.
Yes, exactly, they offer nutritionists. They pretty much offer any type of preventative care, because they want to keep you well and keep you out of the hospital, because
Right.
the sicker
They don't
you
wanna pay.
are, the more they have to pay
Right.
to cover the expenses. So
Mhm.
nowadays they have a lot of programs that will assist with keeping you healthy and preventing illness. Like it's already been stated, prevention and education is a big thing with the health insurances now. Whether you have private insurance, Medicare, or Medicaid, that's a big, that's the one of those two are, they go hand in hand, prevention and education. So, and if you have a private insurance, you may just have to reach out to your insurance to see the benefits that they do provide. And a lot of insurances, another thing, a lot of insurances have apps. So you can even go onto the apps to get points, and they have different point systems for rewards. So definitely look into that.
Some of the insurances, the private insurances will also indicate, have you had your recent like colonoscopy, prostate exams, mammograms? Because again, as you say, these are preventive. And so they want you to know, have you been up to date on a lot of these things? Have you taken them? And they'll give you, sometimes they'll send you a list of things that you should probably have taken.
Mhm.
And with those, every time you complete one of those, for my insurance, because I Medicaid, when members complete like the colonoscopy, the annual eye exam, the dental, the mammogram, there's other things also. As the members complete those, they send them rewards like gift cards. And these are just incentives to continue you on the path of preventing illness.
So all these insurance companies should be connected to Kathy Jackson.
That's what I was about to say.
Yes, they should.
I would like to say that because when I heard silver slippers and you need your,
Sneaker.
you see, build the body. So
Yes.
exactly. So listen, if you don't have that insurance, I offer several classes that are right around the corner from Morning Star on John Street. Let me say 1025 John Street every Wednesday at 1:30 to 2:30. This is a new class that I just started, and it's for beginner strength training class for seniors, teaching you how to work out with weights if you never worked out with weights before. In this 2-3 pounders, in that always correct form, teach you correct form and how to work with those weights. So, and there's total functional exercises, things I put you in movements that you're going to use in your daily activities. Like you reach up to grab something, you have to bend down and turn to pick up something. Just sitting down and standing up. Those are exercises that I'm offering every Wednesday. And also on John Street, 11:30 to 12 on Thursday, chair aerobics. Some of us have been in those classes.
Yes.
And enjoyed them. So 11:30 to 12 on John Street every Thursday, a 30-minute class, chair aerobics, all in the chair, and weights are optional. And then Friday, again on John Street, 11:30 to 12:30, you get an hour. You get 30 minutes of chair aerobics, and we slide right into chair yoga. And also we have some balance and exercises that we do. And if you can't make it there on John Street, Wednesday, Thursday, or Friday, I'm in Roselle every Monday. Oh yeah, I'm over there too. Thursday. Thank you, Gregorio Center, Thursdays, 12:30 to 1:30. I'm there to another hour, 30 minutes of aerobics in the chair, 30 minutes of yoga in the chair. And again, you get your balance exercises. Roselle, Monday and Wednesday, 12 to 1. Same thing, hour classes, aerobics and yoga. But on Tuesday, we have in Roselle a strength training class that promotes healthy bones. Now, this is out of the chair, and we're working with weights, senior friendly. All right. So if you can't get silver, what is it? Sneakers?
Sneakers.
Silver sneakers, and you don't have the insurance to get that, these classes are free. You do not have to pay anything at all. Never, ever. And I might even give you a t-shirt.
Yeah.
Mhm.
Well, listen, this has been fabulous, and we have, of course, run up against the clock now. So, but what I would like to do is to, take time to ask each of you to give, whatever closing comments each of you would like to make, individually, and speaking to the audience about anything with respect to their health, any message you'd like to leave with them. We can either begin with you, Dr. Muriel, or end with you. Your call. You make the arrangement as who should go first and who should go last. But let's have some closing comments from each one of you.
I started, so I guess I'll finish. So yeah.
Okay, I'll start with my closing remarks. So my closing remarks or my takeaway is to, take care of your gut health.
Was that it?
No.
No, go ahead.
Brielle.
Take care of your health, your gut health. And then also, a big thing that I just stated is reach out to your insurance to see what benefits they provide when it comes to the incentives, as well as preventative care and education, as well as nutrition, because they cover it all. You just, like Deacon Hardy said, you just need to, you have to advocate for yourself. I mean, it's not going to be just thrown in front of your face. They do sometimes they will reach out to you if you have like a hospitalization. That's when they reach out to you. And that's about the only time they reach out to you, because you had a hospitalization and the expenses for your care have went up. But other than that, you have to reach out to them, and they will walk you through everything. They will assign you to a case manager. They will get you started with rewards programs, any like gym memberships if they offer that, as well as that nutrition piece that is essential.
Thank you. Thank you.
Okay, so I'll go next.
Yes.
The takeaway is, again, as I said, we're having the flu season and COVID season, so make sure you become vaccinated, whether you get it from CVS or Walmart. You have for COVID, you have the 3 different vaccines that you can take. They're all effective. Some people, you don't have to take both of them at the same time. As Muriel said, you can space them out. You can take the fluids a period and then maybe wait several weeks to take the COVID, or vice versa. Some people want to take them together. That's your choice. But again, also hand hygiene is very important. And then also, as we go into the winter season, please remember that you're going to have to wear your mask indoors. I don't think the CDC or the states are going to make it like mandatory, but I think those who are immunocompromised, the elderly, and even other people, you just need to be, if you're going to be in a crowded situation or indoors during the summertime or during the wintertime, to make sure you wear your mask. And as you can remember that, COVID is not seasonal. It's in the spring, it's in the summer, it's in the winter. Influenza is seasonal, but it's not. So those are some of the takeaways. And one last thing, because someone asked me this and I told them that was fine. In terms of, we didn't talk about it, but in terms of the bird flu, the USDA and the CDC, they're not going to send you any sick chickens or sick eggs or anything like that. They check all of that. So, that's fine. Someone asked me, can I eat a chicken or whatever? I said, yeah, you can eat the chicken. They check all of that. So, but the eggs are expensive, and that's because the chickens are being killed off. So you may have to cut down on your eggs.
If chickens got in trouble, Black people would be in serious trouble. Oh, Jesus. Sister Kathy.
Yes. Again, I'm gonna say it. You do not have to be extreme to get fit and healthy. You just need to be consistent. And I know I gave you a lot of dates and places where I am. What I'm gonna do is put my number, send me a text and let me know if you need the address and time of any of those classes. Again, the classes are free of charge. I know I get a lot of times people say, well, my leg hurt. When my leg stop hurting, I'll come to class. That's why your leg is hurting. But always check with the first. Check with your doctor first. But they say, my arm is stiff. Well, you're not moving it. You got to move it. Those are the things that I get a lot of. But like I said, the classes are all in the chair, user friendly. You get a workout from the top of your head to the bottom of your feet, and we have a good time. So here's a number. Take this number. Send me a text. It's 732-322-9656. And I can let you know where I am and what time I'm going to be there for you.
Repeat.
Phone number 732-322-9656. Now send a text. All right. Let me know what you're interested in and where.
Great. Dr. Muriel.
I'm gonna paraphrase a famous wrestler. Say your prayers, take your vitamins, eat your vegetables and your fruits, and exercise and listen to Pastor. Good night.
Well, listen, God bless each one of you. This has been fabulous, and we thank you so much for giving um, of your time and giving of your expertise. You've been a true blessing. And this is this, by the way, for those of you watching, this is our health and wellness ministry, a portion of it, and this is why we're so blessed at Morning Star from a health and wellness perspective. These are our experts, and they are in the process of rejuvenating, reactivating, replenishing, and soon they will be giving us our numbers and doing whatever else they do on a regular basis. And we're so grateful. We appreciate all that you have done in the past, that you are doing now, and even as we speak, that you do on a regular basis. We thank God for you. And certainly we thank you for this evening. Let me remind those of you who have been watching us again, the Youth Ministries Back to School Breakfast is this coming Saturday. That's the day after tomorrow, Saturday at 10 a.m. at the church. The Youth Ministries Back to School Breakfast is coming Saturday at 10 a.m. at the church. Be mindful and be present if you can make it. We certainly would love to have you. And of course, Sunday morning, 9:30 a.m. sharp, we have special Right-Handed Fellowship. We're receiving a host of new members into our part of the God's kingdom. A host of new members in Right-Handed Fellowship at Morning Star. Come out and join with us and share with us in this exciting Sunday morning's worship. 9:30 a.m. is our start time, and we'll look forward to your being present with us, of course. And I said earlier, next Thursday, we're going to go as a congregation to share with True Word Christian Center in their 5th anniversary celebration down in Elizabeth, New Jersey, at the corner of East Jersey Street and 1 and 9 on the south side. That's where Pastor Leonard Grayson is the pastor, and we want to help them. And they're a young church, a young sister church, and we want to be a blessing to them. Thank you so much for your willingness to come out, and that will be at 7 p.m. next Thursday evening. God bless you. Thank you so much for being with us. We look forward to seeing you on Sunday, and those of you who are coming out, we look forward to seeing you at the Saturday morning, 10 a.m. Back to school breakfast. And between here and there, continue to be blessed, and God bless you.
Thank you. Good night.
Thank you.